Hello, everybody. Welcome to Cat Talk Radio. I'm your host, Molly DeVos, and today we have Dr. Brian Hurley with AmeriVet Veterinary Partners with us to talk about skin disease. Now, I want to say this is a really broad topic. So we're going to talk about everything from wounds and abscesses and allergies and all the kinds of things that could possibly happen to your cat's skin. And Cornell University says that studies indicate between 6 and 15% of their feline patients have at least one dermatological issue, and some suffer from more than one. So, welcome to Cat Talk Radio this month, Dr. Hurley. Let's talk about skin.
Sounds good.
So, like with people, is skin on the cat their largest organ?
Yeah, so both people and pets, the skin is the largest organ, comprising anywhere from 10 to 24% body weight.
Oh, wow. That's a
Yeah,
lot. And what are the purposes of skin on a cat? Is it like humans also?
yeah. I mean, skin is there to protect our internal organs, protect everything inside our body. Depending on where you're looking at the cat, just like in humans, skin can be a little thicker in some areas and thinner in other areas. So, but it definitely serves as a protective layer.
Does it also regulate body temperature like our human system does, or is their fur kind of take the place of that more so?
Well, I mean, I think it all plays together. I think the fur, just like us putting a coat on,
Right.
um, helps protect. I mean, obviously, our skin isn't as hairy as others, but we still have to protect it. And our pets are no different. If they go outside in really cold weather, they're going to be predisposed to frostbite and all those things that we are. So it's not the end all be all, but that's kind of where we're at in the protection of the more of the organs, the bones, that type of thing.
And speaking of temperatures, a cat's body temperature, normal body temperature for a cat is like 102, isn't that right?
Yeah, I usually say 100.5 to 1025 would be considered a normal body temperature for them.
Yeah, so it's much warmer than ours.
Correct. Yes.
Yeah. And does that mean that they are warmer, like when the temperatures in your home are, set a little warmish? Are the cats even more warm and not as comfortable or?
Because I mean, if you think about it, I mean, we're usually not setting our temperatures higher than their body temperature. So,
Okay.
um, I think that fur adds in just kind of protecting from the elements.
Yeah. Yeah. So are the layers of a cat's skin similar to ours? They have the same layers?
They're very similar. So we all have kind of the epidermis, I think, in which is the outer layer of the skin. That that layer tends to be a little thicker in on the human side than on our pet side.
Hmm.
Um, then we have kind of that dermis, which contains all your glands and blood vessels and nerves and some other tissues that are important in the skin. And then the final layer that we have is kind of that sub-Q layer, that lower layer. And if you think about if you've ever struck a cat, how loose their skin is, they have a pretty dramatic sub-Q space that we can give our injections in and things like that. Where if you look at us, I mean, you try to pull your skin and it's pretty tight. It's not definitely not as elastic as in our pets.
Interesting. So let's say somebody is having problems with their cat. What would some of the clinical signs of skin disease be that someone should be alarmed and seek a vet for?
It can be a wide range of things. Oftentimes, you'll see your excessive licking, particularly scratchings, being another one. Hair loss is always an indication that something may be going on. Then you start running into uh, bumps, scabs, uh, flaky skin, All these things start to lead you to believe something is going on. Sometimes it can be swelling, as you mentioned. I mean, there's a lot of different things that can affect the skin, and abscesses tend to, present as a fluid filled bump.
Mhm.
So those are things that you'd be looking for.
And what's the most common skin disease in cats?
Whew. I think they there's that range, right? So thinking about outdoor cats when they're coming in, I'm always thinking abscesses or
Mhm.
wounds,
From
whether
fighting and
from fighting, getting, hung up on something, so if you have a laceration, those type of things. But then you have bacterial infections, you have food allergies, you have the inhalant allergies that they suffer from, just like people do. Any of your ectoparasites, your fleas, your ticks, and as we already said, abscesses. Sometimes, if they're on certain drugs, they can have reactions to drugs as well. They can have an adverse drug reaction that can manifest as a skin problem.
and so you'd said allergies, like inhaling allergies, like pollen or whatever else that might be in the air that they're allergic to, that will actually show up in the skin sometimes.
That's usually the primary manifestation with allergies
Interesting.
are your skin lesions. And then the one I forgot, which is really common, again, particularly in outdoor cats, are ear mites. Because if you
Mm.
think about the ear canal is just an extension of the skin, and that skin is formed in a tube that goes down into your ear, leading to your eardrum. And so ear mites are pretty common in cats as well.
Oh, wow. I didn't realize that. Now, do they get dandruff like we do?
Um, Absolutely. So anytime you get those white flakes of skin, I mean, that's really what dandruff is. For us, it typically is on top of our head. So, but for our pets, they can, having their entire body covered in fur, you can see it just about anywhere. But primarily, you might see it on their head, their neck, their back, are probably the big areas. The tail base is where you're going to
Yeah.
see the majority of the dandruff.
And that's usually because they're so obese they can't clean there, though, right?
It doesn't necessarily have to be due to being obese. Yes, that plays a role in it, but anytime there is disruption in the skin, that can create it too. So you can see flaky skin in certain disease. Any of those skin issues that we've talked about can lead to that just because of uh, the underlying medical issue.
Interesting. Interesting. And is there a difference between dandruff and dander? I talked about this a little bit in a podcast before, and it was, what's your opinion on that? Is it the same thing?
I I think by definition, the way I would kind of look at it is dandruff you see. That's going to be that white flake skin. You look, you go, oh, look at all this white flaky skin. That's probably dandruff. Dander is more microscopic, and obviously is one of those underlying thought processes that the dander from the pet creates some of the allergy, but it's again just microscopic, and it can float in the air. It can attach to beds and furniture and floors, and go just about anywhere. But you don't tend to see that as readily.
Let's talk about allergies, not allergies people have to cats, but allergies that cats have to, it kind of breaks into two categories, right?
Mhm.
It's either the environment, they're having an environmental allergy, or maybe they're having a food allergy or allergic reaction to something that they ate. Both can show up on the skin. And there are different places in the body that the skin gets irritated that kind of help you decipher what that might be, right?
That's usually the first step. It depends on when you're getting to see them, you know, because that can play a role. The more advanced the disease process is, the harder it's going to be able to use location as helping drive where you might go. So when I think about food allergies, for instance, I'm usually thinking about the head and neck being the first place that that's going to manifest itself. Sometimes with the food allergy, you can also see some GI signs, diarrhea, vomiting, those type of things. Where if I'm thinking about fleas, while the head neck is one of the areas because fleas like to get to the highest part of the pet, the tail base is also a common area. So when I'm seeing scabs and redness at the tail base or fur loss, I'm 100% thinking fleas. And the unique thing here is what we have to remember about cats are they are really clean.
Mm-hmm.
And so sometimes we have to go off that location and be thinking sometimes fleas, even though we can take a flea comb all day long and not get them because they're just picking those things off left and right. Because when they get bit, they just, they go clean themselves and they ingest that, flea, which then sometimes we might see tapeworms. So that gives us an indication that maybe fleas were involved. But, so that's important. And then as far as the environmental, it can be anywhere. It can show up anywhere on the body, so, but it does kind of help you come up with that differential list of let's treat this for, because allergies tend to be lifelong. And I much rather in some ways have a flea issue than be thinking a food allergy or inhalant allergen, because at least I can try to control the fleas with preventives and things like that to try to help the pet out.
Yeah. Now, I've seen some cats have hair loss when we talk about environmental allergies, things they come in contact with too, like maybe cleaning supplies that you're using or whatever on the base of the backs of their legs, paws to their elbow, if you will,
Absolutely.
where they lay down, right?
No, absolutely. So anytime um, cats come in contact, that can be an irritant. Obviously, you also get uh, behavioral issues too that a lot of times I'll see affect the limbs just due to over grooming. A lot of times those are due to that over grooming, uh, trying to keep themselves clean and get rid of the irritation.
Yeah, I was
I always
gonna.
say, in our pets, when we have an ache or we have an issue, like we'll scratch or we'll rub. They can't really take one paw and rub the other one if it's eating them. So all they have is their tongue.
Yeah. I was gonna ask you if you see hair loss on a stomach area, you're more likely to think over grooming than allergies?
Depends. Where I start thinking about over grooming or an issue like that is going to be in a case where the cat is perfectly normal. Otherwise, there's no scratching, there's no bumps, there's no redness.
Mm.
It's just bald, and it doesn't lead me to think any direct. Now, I still might go with if they're not on flea medication, get them on flea medication just in case. Um, I'm not necessarily going to jump to allergy testing and doing all these other things if it's not bothering the pet or creating any issues. Um, because I always think about that behavior component, particularly the belly. That seems to be a good one where they just like to pick and it's bald and there's really nothing I can do. Um, and they tend to do fine.
Speaking of bald, do cats lose their hair as they age like we tend to, or get thin?
No, so they really don't, because the unique part and the difference between humans and our pets is in humans the hair is always growing.
Mm.
It's always kind of replacing itself, and then obviously they can become bald. In our pets, they they cycle through the growth. So there's three stages of hair growth. So you have the actual growing phase where the hair is being replaced. Then you have a second phase where the hair will kind of stop growing, and then the root or the ball of the hair follicle will go through degenerative changes. And then there's going to be a third phase where just everything quiets down. And so the hair has shut down and it's not doing anything. It's just there. And throughout the entire phase. It's not like the entire body is going through the same phases at the same time. So it's kind of cycled and daylight can impact all these things, but it's just this constant process. But it does shut down. So
but it will
that's a little different.
regrow. I mean, obviously when you
Yeah.
shave them for procedures and stuff, it does
Yeah.
regrow.
Primarily, I mean, less in, there are disease processes that impact hair growth that will create baldness. So, there are some cats that don't have hair,
Right.
like your Sphinx cats, but in general, they all do. And so if you do start to see a bald cat, you always have to think other things other than just skin, because certain endocrine disorders can create issues and impact the hair follicles, immune diseases. So, as you said, it's a pretty broad issue, because the skin, being that largest organ, is going to be impacted by so many different things.
And let's talk about fungal for a minute, right?
Mhm.
So ringworm is the first thing we think of. Are there other fungal issues that happen with cats?
I mean, ringworm's probably the most common. There are different types of funguses that can impact them, but the bottom line is that we're concerned with fungal infections because most of them are contagious to us. So we have to be real careful in that human counterpart getting that disease, just like the cat. So, it's not uncommon sometimes in private practice that a human would go to their doctor. The doctor would say, "Hey, you have a fungal infection. Oh, do you have any pets? Because you probably got it from
Right.
your pet." And unfortunately, spores live out in the environment. We can pick them up anywhere.
Yeah.
We can pick them up, and our pets can pick them up. And it's why we're so diligent in trying to treat these things, because, obviously, as you're treating, you don't want everybody in the household to be impacted by it.
Right. And they live in the environment in a home for up to a year, right?
Yeah, they can
It's a
last.
long time.
It's why, yeah. I mean, so we're usually, it's one of those adages, just like in the olden days when you were treating fleas, part of the treatment process was vacuum your house, wash everything, and then throw your vacuum bag in a dumpster somewhere away from your house so they don't get out of the vacuum bag. But it's kind of the same thing. You have to do your due diligence of bagging everything up and closing it to try to minimize the impact in the environment, because that's where we tend to run into those difficult fungal infections to treat.
Yeah, it's always a foster parent's worst nightmare when they get that litter of kittens with ringworm, and then how
Right.
it extends fostering by so long, and the amount of cleanup and
Yeah.
break you should take between fostering another litter just to make sure your new litter doesn't pick it up in the house somewhere. Yeah.
Yeah. I mean, I'm surprised over the course of, my career in uh, seeing appointments. I swear every time I saw a pet with mites or fungal, I immediately left the room and started itching, swearing I was going to have either the mites or the fungus. Fortunately, I really only got it a couple of times, but
Yeah, I think all of us around animals have gotten at least ringworm a couple times. Now, mites also will migrate onto humans and get in our ears or hair or both, or
so so obviously ear mites are contagious cat to cat. There are mites that are contagious to not only the pet, but also to humans. So scabies is one of those that we see. There are some that aren't too. So um, I in the course of my career, unlike the dog, I did not see as much with mites. And I think part of that is a lot of our cats are indoors,
yeah.
and so the exposure to pick them up. It just isn't going to be there. Where our dogs are still going outside to use the bathroom and walks, and so they have a lot more risk of coming in contact. The good news is, I think all the newer preventives, like your Brevectos and Next Guards and all these newer class of preventives for fleas and ticks, are also controlling the mite. So, I think if we could get 100% of every pet on those products, we could probably eradicate mites, just because it's so effective at helping kill the mite. And so it's protecting our pets a lot better. So
Yeah.
we don't see it as much.
I probably see it a lot more just because shelter animals, they're mostly coming in from the street. And so especially the little kittens that are, born out there, ears are always a mess.
Yeah, you're battling it all. Absolutely.
Yeah. Let's talk about catney. I call it acne. I call it catney. I had one cat that I remember I was panicking because it had bumps on his chin, and I thought, oh my God, he's starting to get a growth. Talk about what that is and where it comes from.
So really, they're not 100% sure of why some cats get it and some don't. The prospect is they're just producing an overabundance of the keratin, in the skin. They think it could be associated with poor grooming. They think it could be just the oil production. They think it could be immune issues with certain pets. But it can occur in all of our cats. It's associated with the hair follicle. You don't tend to do anything like, you don't want to be picking at it and doing those type of things. Normally what we end up doing is, depending on the severity, if you get a lot of redness or infection, part of it could be treating with antibiotics. But one of the things that I always did in those cats are sometimes use wipes that are treated, that kind of help control and keep that area clean. The other thing I've always recommended is, if you're feeding your pets out of plastic, I usually tend to recommend ceramic or glass bowls, because that plastic tends to keep the oil from the food that you put in it. And so then as they're eating, they're rubbing constantly and making that area dirty. So I always say, hey, after they're eating, after they've eaten, go ahead and kind of keep that area clean, because it's a managing thing. Some cats I treated once, it could take 4, 6, 8 weeks to go away, and then they never get it again. And then you have those that are just chronic, just like people.
Yeah. And would you wipe
Um,
it with like a warm cloth with maybe some Dawn dish detergent on it, something like that?
Usually there are medicated wipes. I always say, for our pets, they do have the Stridex pads that you can use, that have the have the antiseptic and cleansers in them. So it just helps keep that area clean, and it's safe for use. Obviously, that's an area where it's going to be harder for them to lick.
To groom.
Yeah, so those usually I think are the most effective. Is one of my favorites were these Malicev wipes that I mean, I use those a lot in any skin issue, skin folds in dogs, that type of thing, just because it's such an easy way to clean that area. The problem sometimes with water is, if that area is not drying, that can create, issues as well.
Yeah, sure. Now let's
And
talk.
definitely soapy is not recommended, because that you guys spend a lot of time making sure you get all that soap off there.
Well, that's true too. And it's 47 more wipes with water, warm
Exactly.
water to get it. And then by that time, the cat's over it.
No, absolutely.
Now let's talk about another nasty skin condition, mange. Right? Tell us about mange. What is it? Where do they get it? Can people get it? I know there's different kinds. I know in the shelter we go, well, it's either this kind or that kind, and I can never remember which one we should be more worried about.
Right. Well, so the mange that we are oftentimes talking about, is going to be a mite that they pick up. and they're usually going to come in contact with it, like usually out in the environment or in a shelter situation. Again, if you bring a pet in that has it and there's more contact, that's going to be of risk. They're very itchy. This is the one where, for instance, there's a Demodex mite that is not contagious, and it can, create some issues and have some itchiness. But when you're talking true, the mange that everybody associates with, it's the one that, I mean, the pets, you go, hey, what's on a scale of 1 to 10, how would you rate their itchiness? And they're like 15. Like if they're not eating or sleeping, they're scratching.
Mm-hmm.
Um,
And hair
and
loss too, right? We always see
oh,
the horrible
yeah, because
scaly skin and hair
they,
loss.
they'll live in the skin, and most of it because it's so itchy, the cats are licking and grooming and scratching and just tearing the hair because they're just so uncomfortable. It's not necessarily painful, it's just incredibly itchy. And so that's one of the hallmarks is they just start to lose their hair. A lot of times we'll see it around the ears and starting in those locations, but it can go anywhere. And like I said, and oftentimes in my history, I will ask, whether it's fungal or mange, is, hey, have you anybody in the house having an issue?
Mm-hmm.
It's kind of a silly thing to ask, but it definitely can drive where I go next if somebody in the household is also being impacted, because now that really narrows down what I should be thinking. And invariably, for whatever reason, I guess it's because we have that doctor in front of our name. I mean, I've had people go like this and they left their shirt, and I'm like, whoa, don't need to see it. I just wondered if you had a rash.
And the other kind, that thing, is it sarcoptic mange or scarcoptic? How is it?
Yeah, the biggest one in cats, the feline scabies, is the notodectric mange mite. The notodectric cat eye is the one that that we see mainly in cats. The sarcoptes, we see a lot in our dogs, and that's highly contagious to people. Again, I usually didn't see, that if the dog had it, the cats in the household also came down with it.
Mm.
So, but yeah, again, in private practice, it's probably the least one I diagnose.
Yeah, we see it a lot in the shelter.
Yeah,
There's a whole section in the back of the shelter for ringworm and mange cats. We try to keep people from going back there and sticking their fingers in, and it's the hardest to get fosters for, because
right.
who wants to take that risk and have it in their environment and risk their own pets getting it too. So it's those two are the biggest issues for sure.
Yeah, no, absolutely. And they are, like I said, there's they can be lengthy to treat, they can be difficult to get rid of. And like I said, no one wants to bring it into a household with other pets because there's going to put the pets at risk and puts them at risk. And it's, and it's a lot of treatment.
Yeah.
I mean, unfortunately, it's not just give them a pill and, it's done. Fortunately, a lot of times we're bathing and using things that help, kill, whether it's mange. Now, the nice thing, like I said, with mange, with the newer medications, we do see some impact on helping that, in the treatment versus where it used to always be baths. And as we have discussed before, water and cats aren't the simplest to
Yeah, no.
navigate.
Not at all. And that stuff you have to bathe them in is stinky too. It
Yeah,
smells horrible.
yeah. No,
Yeah.
absolutely. And there is another mite, and I don't know if you guys see it much in the shelter where you are, is the Kidiella, which is
Mm.
the walking dandruff. So it looks like the
Oh, wow. I've never seen
dandruff
that.
is walking across the cat. So that's one that we can see as well.
Interesting. Now, are there different colors of cats or breeds of cats that are more susceptible to skin disease than others, or is it like people, it's just a matter of what you come in contact with?
I think all our skin diseases, um, while you can always think of certain breeds that you may see heavily represented with certain skin issues, I, I think in practice, I just think any cat is prone to it. I know that there was a study you had mentioned of it out of Cornell that looked at Himalayans specifically, and and they could say, hey, well, yeah, we're seeing a highly represented allergies in this breed. And and then they try to figure out, okay, what may be playing a role, and they're like, anything that can be genetic. So with the breeding and all that, that could be playing a role in having these lines, passing it down.
Sure.
But in theory, I think we could probably start tracking that across any of them if we started looking at enough cases to almost get to that same correlation. So I can't really say that I would go, these are the breeds I would be, leery of, because I just think allergies are allergies, and
Yeah.
it's going to impact, as you said earlier, 6 to 15% of our cats are going to have something at
Right.
some point in their life. Now, hopefully it's the easy stuff, because the one thing that, that I was really careful to make sure I discussed with cat owners and dog owners for that matter is, it's one thing if you're dealing with a wound or you're dealing with an abscess. Those you treat, they heal, and you're done. When you start dealing with allergies, food allergies, um, other medical conditions that create issues with the skin, these tend to be lifelong. And, our job isn't necessarily to cure all of these, because you don't cure allergies. What you try to do is do things that help limit the flare-ups, so the owners and the pet can be comfortable for longer periods of time. And so it's really important to have those conversations, with your veterinarian. Again, if we're talking scabies, we can treat it. And as long as there's not an opportunity for reinfection somewhere, you're probably going to be good. Fungal, the same thing. If they're going from the shelter, you get rid of it and you put them in a house and they're strictly indoors and with or without cats, but there's no risk of, or very little risk of coming in contact, you're going to cure some of those things. But your allergies, your food allergies, those are oftentimes lifelong.
Yeah. Now, would the length of hair make any difference? Like if it's, I know grooming plays a big factor in, yeah, I guess, and of course them getting the skin clean. And so it would make logical sense that if a cat's got longer hair, it's not able to get down to the skin to clean. Does that might play a factor in the Himalayan thought, or?
All those can be, the more fur, the harder it is for things to get down to the skin, so you can have mosquito bite hypersensitivities. You don't tend to see that on the sides of a cat or on the neck. It's usually on the bridge of the nose,
Mm,
around the ears, because at that point, there's very little fur, so they have easier access to the skin that then creates that problem. So the skin can play a role at protecting the body. I mean, the
the
fur can
fur, yeah.
play a role at protecting the body, but that doesn't necessarily mean they won't ever get an allergy.
Right. Right, right. Well, this has been fascinating. And other than the shelter animals I've pulled, thankfully I've had relatively few skin issues in my personal pets over the years, other than Tabasco having his catney on his chin. So
Yeah.
yeah.
Yeah. And like I said, fortunately, we don't see a ton of chin acne, but it happens.
Yeah. Great. Well, thank you again for joining us
Oh, you're
on
very welcome.
talking about skin, and we'll look forward to talking again next month on some other wonderful cat talk. And
Sounds good.
thank you everybody for tuning in. And until next time, keep calm and purr on.